This is a 2.5-year-old child with a diagnosis of Down syndrome who presents in clinic with low muscle tone and delayed acquisition of motor skills and pretty mild pronation, less so than I might have expected with her low muscle tone. My therapy goals for this child at this time include working to improve trunk strength overall, working to improve gross motor skills, including progression to jumping, stair management, alternating feet, kicking balls, catching balls, throwing overhand. Other goals that we're working on include some of her fine motor skills, her grasp, crayons and markers, encouraging her to use her non-dominant hand to hold the paper down. And since beginning walking, she's just been on fire with her motor skills and has made a lot of progress in all areas. As she moved through the early stages of walking, she had some Patty Bob shoe inserts and had pretty good results with those in terms of correcting for the pronation. But we decided when she outgrew those to go just one step more aggressive and noticed that she had mild heel eversion with the pronation, so we chose the PollyWog inserts, which kind of cup the heel a little bit and bring the heel more in neutral midline alignment. She's had good results with those. Looks like her pronation is addressed effectively, as is her heel alignment. The biggest difference in the quality of movement with this child when she is wearing the PollyWogs is that she seems to have better knee control for squatting, lowering to the floor, and ascending and descending stairs or curb steps. She's more secure about where her foot and ankle position are, and I think her gait is improved. She is definitely more stable on her feet and performing gross motor skills when she's wearing the shoes with the PollyWogs in them. Swinging is great vestibular stim to activate the reticular activating system in the brain, which has been shown to have a positive effect on muscle tone overall and trunk tone. It also provides for vestibular movement in planes that she might not otherwise experience. She's not crossing midline well, so occasionally we'll use mild physical restraint of one side to encourage reaching, grasping, and crossing midline. It's a fun activity to kind of warm up with, I find. On the big therapy ball, she enjoys bouncing, which again can help facilitate postural muscles. They'll activate with the compression through the vertebrae. Balance reactions are required to stabilize her as we shift side to side, front to back. This child is working on her trunk strength as well, in prone positioning on the ball. And then sometimes as she'll roll onto her back and is performing almost a full sit-up, we're getting good work in the abdominal muscles. We're working on gait stability and safety on a variety of terrain. Curb step management. She's often tripped up here in therapy by a 4-inch curb. Oh, crash that time. She's showing progress with that. I think that jumping tends to be a difficult skill for kids with low muscle tone because they just tend to have a little less postural security and ability to make those quick postural reactions needed once they land. Gravitational security is kind of part of the picture with that, as is coordination. Pushing shapes onto the mirror, this is a fun activity for this child. It allows her to explore how the shapes work. The feel of the suction and removing them is a nice sensory experience. The strength required in her hands, shoulders, and arms to kind of stabilize and push gives a nice therapeutic benefit. Also gives her just an opportunity to explore the consequence of the activity. Rising on tiptoes is a wonderful activity for kids with low muscle tone and especially kids with pronation. As the child rises onto the tiptoes, the supinators are strengthening and intrinsic foot muscles. You can just see them pulling the child out of that pronated position. And so I think it has a nice benefit. I'll see as they come out of tiptoe down onto the floor, they tend to be a little more neutral, even just for a moment. It can be really tricky to deal with a 2-year-old exerting their independence and to deal with that in a therapy setting.
Here, I'm going to give you a hand. Oh, gonna slide down this first time? Okay. Can she help?
Yeah.
Okay, thank you. Yeah?
You have to ask for permission.
Okay, I'm gonna help. Okay, push. You want to do it again? More? Go get another. Can you get more?
Yeah.
Yeah? You can.
Yeah.
Get another pig. Oh!
If it's a matter of trying to get a child to do something that I know they can do and they're expressing no, I think there are times in which I let them have some control, and there are other times when they need to complete an activity. Sometimes giving a child a simple choice between you try it or I can help you try it, or you do it by yourself or I can help you. Sometimes that simple choice itself is enough to get them to go the direction you need to or perform the skill you're looking for.